Hello, everyone, and welcome to another exciting and empowering episode of HERcast with Dr. Chito. This is actually our first episode for the season, so it's going to be exciting. This is where we inspire boldness and transformation in women across the globe. Today, I'm honored to introduce an extraordinary guest, a trailblazer in healthcare, an inspiring leader, and a true change maker. Joining us is Dr. Modupe Elebute-Odunsi, the co-founder and CEO of the Marcelle Ruth Cancer Centre and Specialist Hospital, and founder of the Women in Healthcare Network. Dr. Elebute-Odunsi's story is nothing but short of incredible. After completing her medical degree at the University of Lagos, she honed her skills in internal medicine and hematology in world-renowned centers of excellence in London, with an impressive career spanning decades, including consultant and senior lecturer roles at the prestigious institutions like St. George's Hospital and, of course, King's College Hospital. She returned to Nigeria in 2020 to establish a world-class cancer center, but she didn't stop there. Her passion for supporting women in healthcare led her to found the Women in Healthcare Network, and I am a proud member, a platform dedicated to mentoring and empowering women across clinical and non-clinical specialties in healthcare. So in this episode, we will explore her remarkable journey of resilience, her groundbreaking work in cancer care and advocacy, and the transformative power of mentorship. So grab a cup of tea or maybe a glass of wine. It's Saturday morning. Find a quiet moment and get ready for an inspiring conversation with the phenomenal Dr. Modupe Elebute-Odunsi. It's such an honor to have you on HERcast with Dr. Chito. I remember when we spoke for the first time in 2020, and you were at that point in the process of setting up this cancer center, which of course we know is so important because there's a huge gap in cancer care. And now is one of the best cancer centers. I always go beyond Nigeria. I would say West Africa and beyond. And you've done so much with it. And so I want to say a big welcome to you for joining me here on HERcast with Dr. Chito.
Thank you very much. Good morning, Dr. Chito. I'm very excited to be here and really grateful that you're making the time to let me, have this conversation with you. I've watched your podcasts over the last couple of seasons, and I found them, really informative and really fun as well. So I'm looking forward to this morning with you. With my cup of tea, yes. Thank you.
Great. Your journey, as I said, has been nothing short of remarkable, from your career abroad to returning to Nigeria to establish one of the leading cancer centers beyond West Africa, and also founding the Women in Healthcare Network, which I believe is going to be is a powerful network of women. Can you share with us the pivotal moments and personal motivations that shaped this inspiring path, and what lessons other women can take from your story to pursue their own bold visions?
Wow, thank you. And thank you so much for the introduction. I was wondering, is she actually talking about me? And yes, again, I do remember that phone call, just calling you to please see a patient who had been in contact with me, but I hadn't actually come back to Nigeria at the time, and I needed somebody, and the patient was in Abuja, and obviously we were coming to Lagos, and you incredibly helped to look after her. So thank you for that. Now, yes, it's been 4 years now. December 7th, 2024 marked 4 years that we opened Marcelle Ruth Cancer Centre and Specialist Hospital here in Lagos, and it's been, as you say, an incredible journey. Now, thinking about the whys, because of course people ask me this all the time, and to be honest, it was a personal decision to want to come back home, to come back to Nigeria, to come and practice medicine here, having been through a lot, learned a lot, acquired lots of skills, had lots of opportunities during my postgraduate training, both first of all in internal medicine for almost 10 years, and working in that setting. In the UK, before you can go into hematology or oncology, you have to do internal medicine postgraduate as well. I think it's the same in the US. So I'd done that, and then I'd done my hematology. And along the way, I'd had incredible opportunities and difficulties, but I always sort of remember the opportunities. One was in being able to do a full-time 2-year research program that was funded by the Leukemia Research Fellowship, which was a very prestigious fellowship. And at the end of that, realizing that there was a life beyond clinical medicine. And in fact, that life in terms of research and development is crucial to help us improve patient care. And then later on, after doing my hematology training, also having opportunities to work in 2 of the biggest teaching hospitals in the UK, but St. George's Hospital initially, and then later on in King's College Hospital, and also did some work with the Royal Master. And so for me, there are just so many opportunities, so many, I think blessings, I would say, really, from God, because a lot of us left after medical school or just after medical school to go and do our postgraduate training, and but to actually have had the to work in these prestigious hospitals with incredible, eminent professors and other teams. Getting towards the end of my career, I was thinking to myself, look, yes, you've been blessed, you've learned a lot, you've done a lot. It's time to really go back home. And go back home whilst I could still work as a doctor, fit enough, energetic enough, and to possibly teach. That was really what drove this move. So when people say, oh, you've made a lot of impact and it's great, to be honest, the impact or making the impact was not even anywhere in the vision. The vision was really just to come back home and to come and work in hematology, oncology, and to help in that sector, really. Yeah. But it's certainly in the private sector. And of course, I know quite a bit about the private sector in Nigeria because my parents, Professor Emmanuel Elebute and Professor Elebute, having left the teaching hospital and the College of Medicine, where they'd had fantastic careers, set up private hospitals, Lagoon Hospital, and the HERcast system. So I was aware of all the changes and the impact that the private sector was making in the healthcare arena here. So that's really, from that point of view, what drove that maybe vision or passion to come back. Now, as always, and I'm sure when all of us sit down and think about what we've been doing and how we got to where we were getting to, there are people who were strategic in that process. So initially, I just wanted to come back and have a 2-bedroom flat that I was going to renovate. In fact, I was already looking at places in Lagos. And I remember vividly going to this dinner party. A girlfriend of mine invited me to in London, and sitting next to this gentleman who was asking me who I was, what I did. And I was so passionate then about the coming back that I told him my whole story about how I wanted to come back to Nigeria and get involved in healthcare and so on. And at the end of the conversation, he slipped me his business card and he said, why don't you call me on Monday or Tuesday next week? And eventually he was a gentleman called Chris Sterling, who was the head of Global Health Sciences for KPMG in the UK. And so I went to see him and he sort of sat me down and said, look, with your skills and who you are, there's so much more that you can do. There's a huge gap in the cancer setting in not just Nigeria, but in West Africa. And in particular, there's a dearth of radiotherapy centers or radiotherapy services. So why don't you consider actually doing something quite significant in that sector? And that was the beginning of the idea of actually not just coming back to do something small, but coming back to really develop a one-stop shop, a comprehensive cancer center where cancer patients can come and have everything done under one roof. Because previous to that, patients were having to go to one doctor to have a blood test, another one for histology, another one to start the treatment. And then, of course, because there's hardly any radiotherapy in the country, a lot of them were having to leave the country and go to India, South Africa, the UK, the US to have that part of their treatment, having to disconnect themselves from their family. You can imagine a young woman with breast cancer being told she has breast cancer. Next thing, she has to leave and go away. And cancer treatment goes on for quite a long time. So they can be away for 9 months or a year from their children, from their work. So just being able to put that together on one site where people could have comprehensive cancer care has been incredible. Now, of course, none of it has been easy, that's for sure. But I'm grateful to say that, we've now been operational for 4 years. We've seen almost 5,000 patients at Marcelle Ruth. We see on average about 100 new patients a month coming from all over the country. We don't only see cancer patients. I have to make that point. We are a specialist hospital. We look after other patients too, but of course, about 70 to 80% of what we do has to do with oncology care. So it's been a tough 4 years, that's for sure. It really has.
I can imagine.
It has been a lot of work. In the setting where, the whole, things have changed so much in Nigeria since we came back, with particularly the work staff, the staffing being a problem. I started with 6 members of staff in December 2020. I have now got 90 members of staff.
Wow.
I know, and needed, particularly the nursing, the medical staff, as well as the support staff. We have 17 inpatient beds, including 2 IC intensive care unit beds. So there's quite a lot of work that needs to be done. So, the reason for telling this story this way brings us on to the story about the women in healthcare.
Yeah, and that was my next question. What inspired you to found the Women in Healthcare Network? Because I joined, and there's been so much. The networking is amazing. So, and what gap did you hope to fill in healthcare sector with this initiative? So that's my next question, really.
Yes, and I'm great to have you on board, and I'm sure at some point you'll let on to the audience that yesterday evening we were having a
sip and paint.
Which was great.
It was awesome.
Really, so we're on tea this morning because we were on non-tea yesterday evening. But look what some people created yesterday. I haven't painted since I think my children were young, and I was helping them paint. So it was
quite relaxing.
Yes, way to start the year, and being told that everybody's most people's New Year's resolution. Most people's New Year's resolution was to now sort of start thinking about ourselves and keeping ourselves healthy, which is important because as women in health, we have a lot to give to our, not just our families, but our patients and our communities. So the vision for women in healthcare basically came through this journey. I think by the time I got to year 2.5, and just thinking through just how much support has helped to get us to where we are. Getting that support, I think for some reason, when I came back, I made the effort to contact quite a number of people. So Medical Women's Association, the Nigerian Medical Association, there's the doctors, the Medical Guild in Lagos, and other organizations like that, to tell them who I was. I'd come back, and they really were very supportive. And every step when I needed to improve, probably maybe the pharmacy and how to get drugs from genuine places, or how to develop physiotherapy for my patients, I was able to interact with people from these organizations. The other thing was I was actually being asked, of course, because of my journey, to come and give talks and to come and share my story. And particularly, I remember going to speak at WIMBIZ, and there was an audience of about 3,000 women, but afterwards sort of standing around networking, there weren't actually that many who were in the healthcare sector, which actually surprised me, because of course there's healthcare sector in academia, but there's healthcare sector from a business point of view, like you with your hospital and the podcast and so on. And I kept thinking, where are all these women in healthcare? And we can definitely better support ourselves. Look at what the women in business have done to grow themselves, mentor themselves, push themselves into leadership positions. And that was one of the things that I realized. And we know the statistics worldwide. Now, in healthcare, the population of people who work in healthcare is mostly women.
Yes.
Sort of 70 or so, 80% of healthcare professionals are women. Nurses, pharmacists, physio, and so on. Whereas actually, when you look at healthcare leadership, there's less than 5% of women. And this is a worldwide statistic. This is not just in Nigeria. I think we've had one female minister of health in Nigeria. And I recently went to the Healthcare Ministers Summit in Kigali in October. And in the whole of Africa, I think there's one female minister of health to date. There are a number of deputy ministers for health, but then there are hardly any. So, we're doing the majority of the work, right?
Yes.
But we're not in the seat where we are not just driving, but also sort of advising and being able to bring the experience of what we're doing to the table to help influence how healthcare should develop in our country. And I think that was, in summary, what from a higher level made me consider trying to put women together. But on the other side, to be honest, it was more from a selfish point of view of being able to find a sisterhood who understood healthcare, who I could socialize with, right? Who could support me and I could support them. And that was the fun part of it as well. I'm not going to lie. And so when I then took this into, okay, let me do something about it. I was very intentional that I wanted the founding members to be from different aspects of the healthcare systems, both from public and from private sector. It was very important to me that we should work together as one, and also all the different disciplines, and across the ages too, because I thought that was going to be important. So if you look at the founding members, of which there were about 15 of us, there are about 3 or 4 doctors, but there is a nurse leaders, nurse in academia, physiotherapists owning their own business, physiotherapists working in the public sector. There are those in the who are special advisors to the ministers, both of the president and of state governments, and women in research, women in healthcare finance, all formed the founding members of Women in Healthcare Network. And I'm so grateful to each and every one of them. There's a dentist, because the truth of the matter, Chito, is I never met about 70% of the women that I called and spoke to. I just did research either online or I spoke to. Yes, because for me, it wasn't about bringing my friends together. Because, when it's a friendship thing, we just sort of go into ourselves. I really wanted this to be something that could impact or actually help women widely across the disciplines and across the sectors and across the country. But of course, I couldn't have done it if people put down the phone when I called them. But in fact, I think I called about 18 or 20 women, and every single one of them were like, okay, when do you want to start this? How can I help you? What can I do? And that's how we.
And it has grown. It's grown so fast because it really means that people were waiting for this. And because the response has been amazing. Every time you introduce this to someone, they're like, I want to be part of this, because it's so important that we take ourselves from the back burner and put ourselves forward to lead healthcare in a very empathetic way that we do, in a strong way, a resilient way. And I just love the fact that we're doing this. Honestly, I get excited for any event because the networking, meeting new people, new friends, it's something that I think is so enjoyable and so important, in our work.
For me, I think it's been a real eye-opener because honestly, if I'm going to be honest, I thought I would have maybe 25, 30 women where from time to time we'll meet and sit across a restaurant table and have some chats and get to know each other. That's all I saw this as. And when we got to the launch, the night before the launch, we had a dinner, the founding members, and most of us were meeting each other for the first time, only to find out that 2 or 3 people, I think, shared the same birthday. That was how you could connect, and then we went into the launch and we had about 300 or 400 people attend. And then we obviously since then we have held a number of events that have focused on us as members first. That was as networking, getting ourselves together. We had a leadership summit.
Network, yes.
And we've had a leadership, a virtual also leadership group meeting, and we were very lucky to have the DG of NHIA join us at that setting. And it's just going from there up to when we go to the first annual conference, and we had about 500 people in attendance. But it's not just even that number, Chito. It was a number who are involved from the diaspora.
Yes.
And also from across the country. People came from Abuja, from all sorts of places.
Yes.
But people came to Lagos from the UK,
yes.
from the US,
yes.
from Liberia, from Ghana.
Yes.
It was like, wow.
Yes.
What is this? What's going on here?
Yes.
And the powerful messages with our theme of resilience in healthcare network of the panel. We were very, very, such an honor to have Professor Ejoma Uchebu, who we invited because one of the members was Dr. Joanna Coker, who's based in the UK. She's an anesthetist, so a long-time friend of hers. So she said, oh, you must ask my friend because she's so humble, and yes, she's done so much. She's a professor of nanopharmaceutical sciences, and she's just been appointed to this role as the president of the WIHCN College in Cambridge. And I thought, oh my gosh, wow. And I called her up, and she was so gracious. And on that day, she shared her story about how at one point in her career she'd been homeless with 3 children. And I was moderating the session. I was in tears.
I was moved to tears too.
Oh my gosh! How just in the same one lifetime, somebody moved from this sort of position of almost despair and almost hopelessness to the top of her career, and still yet be so humble and so gracious. And of course, you cannot imagine my delight when I, through the news at the beginning of this year, found out that she's been made a dame, by the King of England, right?
So deserving.
Nigerian woman, what I'm trying to say, and in healthcare, and what she's done. And of course, there were lots of other women in the room. I mean, obviously, she was the keynote, but the panels, it was person after woman. And all the things. There was a lady who worked in the general hospitals in Lagos who had lost her son tragically one day, and yet she got herself back together, and her vision was to continue to drive nursing to the highest levels in Lagos State, and has become the top person in nursing, and so on and so forth. There are women who are there's chief medical director of universities, there's the first vice chancellor of the University of Lagos, there's the DG of NAFDAC, but also there were lots of women setting up businesses in healthcare, young women, and especially the young women. I mean, I don't know about you, when they join any of these things, I sit back, I'm like, how, And then they have a main job, but they have a side hustle, it's been incredible. I'm particularly grateful that I wasn't the only one who thought about the idea. There was, talking about it with Dr. Kemi Ogunyemi, who's now become the special advisor to the governor of Lagos State, Dr. Tomi Coker, who's the commissioner in Ogun State. Together one afternoon, we sat at Ishiro Restaurant in Victoria Island, and we're talking about all this. And of course, I sort of didn't drop it and kept going with it, and called other people. But it's been phenomenal, just the amount of support and the amount of work that people have done to every single event that we've done.
Yes,
most of the members have actually curated it and done them, put the artwork, the everything. It's been unbelievable. Yes,
that's amazing.
It's been amazing.
I will tell you that that conference was one of the most inspiring ones for me, because you move back and you're doing stuff here also, and sometimes you're faced with so much challenges doing good, or you think you're doing good, and you wonder to yourself, like, am I really should be here? Should I be here? This is just too much uphill battle for me. Do you understand? And I think for me, going
Yes,
to that conference and just hearing people speak made me feel I
yes,
must be on the right path because they
absolutely.
went through these challenges, overcame, and established themselves and became leaders in their own right. That means okay, this comes with the
Yes,
this comes with the package. It was very inspiring.
absolutely.
Honestly, I'm sure there are people that could have quit. I'm telling you, or
Yes,
in the place of I can't do this anymore. That was inspired. I think the success stories. If you were to ask people for their stories, that I mean, I
yes,
saw the write ups on the group and all that, but I'm sure if you say, "But just tell me a story that came from that conference," you'd be blown away.
yeah,
You're literally
yeah.
blown away. It was very, very powerful conference. Very.
Yeah, I thank you. And honestly, firstly, I want to say that you are doing an incredible job. Don't even because, and I know what it takes because I've spoken to you.
Yeah.
Because you're still trying to do your practice in the US and in Nigeria,
Yes.
and then you have time to do this podcast to showcase topics in healthcare which are very important in a way that gets to a wider group of audience across the country, which honestly is huge. It's powerful.
Thank you.
So never ever doubt the power of what you're doing and the work that you're
Thank you. Thank
doing.
you so much.
Um,
That means a
and
lot.
no, and it's true because, like I said, I met you because I was trying to find somebody to look
Yes.
after your patients, but I found beyond that all what you've been doing and all the support that you continue to give lots of women also.
Yes.
I would say that conference for me, I tell you honestly, I mean, I still remember it so vividly. And I'm so grateful to the women who did share their stories because it's not easy to share your story. And the fact that actually as women in healthcare, we seem to have put together this safe space where people understand that we genuinely need to work with each other. We've got to support each other. Chito, for me, one of the biggest things was the number of women in the public sector who are part of this network. This is not just a private sector group. This is putting, we were in parallel.
Yes.
What I saw anyway, I mean, I would go to meetings that I was invited to in the public sector. There would be nobody from the private sector. We would arrange things in the private sector. There was hardly anybody in the public sector. And now we're working as one.
Yes.
So that was one of the biggest things. And also the number of women, young women in particular, but other women who have contacted me since then and who have actually pivoted from what they were doing on the basis of what they heard that day. Actually, I can do this.
Yes,
Actually,
that's what it gave. Yes.
Yes, I wanted to do more, but I was so afraid. But I thought it wasn't possible. And I'm listening to all these women, and they're telling me that they were on their last legs, or they were in an abusive relationship. There was somebody talking about depression, postpartum depression, and getting through that, and now building a huge NGO supporting women. It's been incredible. Apart from of course, there was the annual conference. We held a virtual cocktail party.
Okay.
And it was very interesting. In that space, there was somebody who wanted to go into the community to set up pediatric and helping to look after children. I mean, she has a pediatric hospital practice. I think, in fact, she works in the public sector. But she was very passionate about wanting to go into more remote areas. And I remember making a comment like, oh, so, you need to get sort of mobile vans and go into, and she said, well, from your lips to God's ears, when somebody else on the group put up her hand, and we said, okay, what? She said, well, actually, I'm a gynecologist, but I have an NGO, and what we've been doing is going into the remote areas to go and see women and to support them and to talk about, in fact, mortality and so on and so forth. And she said, but you're very welcome to have our mobile vans.
Wow. The power of network and to do that's the power of network. Wow.
And there was another lady who was in the US, young lady in the US, who it was something to do with mental health issues. But she can't come back from the US. But she was coming and going and trying to think, should she set up a clinic? And somebody put up her hand and say, actually, no, in fact, she was a physiotherapist, but her specialty was in there's some sort of gynecological, you would know this better than me, problems with like vaginismus or whatever,
Yes.
that's really impacting young marriages, because nobody talks about the pain and the stress and so on from this anatomical problems in the genital areas and how this can impact. And I was like, I've never heard this before because in my field. And she was setting up a clinic and needed a therapist to help her to, to talk to these couples and to support them, but from a professional point of view. And that was the network, the connect, in 1 hour, and it's just been like that.
That's amazing.
That's just amazing. Incredible. Okay. Just incredible.
Now I'm going to go into your work, the charitable projects now. I know that Women in Healthcare Network has a focus on charitable projects for women's health. Can you tell us some of these key initiatives that you're currently running to raise awareness and provide support, particularly around, I guess, breast and cervical cancer? And I'm going to add something to that, because breast cancer awareness is critical. My mom did pass away from breast cancer, although hers was a rare type, because she was up to date with her mammograms. But the mammogram didn't pick it. But in Nigeria, it's really, really significant. What do you think needs to be done to improve early detection and support for women facing breast cancer in Nigeria? And can you tie that into what Women in Healthcare Network Charitable Projects hopes to bring to, like, what's their objective and their goal and how they want to do in this gap?
First of all, let me say I'm quite sorry to hear your mom passed away, and in particular for somebody who was having her, mammograms done and so on. I think the effect of then having a cancer diagnosis is so much more difficult, so much more perplexing, because the person had been making the efforts.
Yes.
So I know that must have been a difficult place, but I'm sure her soul will continue to rest in peace.
Amen.
Yes. Now, in terms of screening, and this is not just for breast or cervical cancer, but in cancer screening in general, we still sit in a place in Nigeria where, unfortunately, we don't have a well-developed, comprehensive primary healthcare sector that is providing screening for our population as a matter of course, as a day-to-day thing, which should be done, which is what is being done everywhere in the world. And the way in which it should run is that once you get to a particular age, 40, 45, you get contacted that you have to have your screening, but that also that infrastructure is in place. So you get told, you need to go to and it has to be in the private healthcare sector. You have to go to your local, your PHC in BI or Yaba or in, Adamawa, wherever, all over the country. That's what we should have. But we don't have it. Okay, what we do have is a number of people attempting to do screening from time to time, and particularly the number of NGOs who are incredible and have been trying to do incredible work in different parts of the countries. And you've had lots of support, like there's the First Ladies Against Cancer. There's all sorts of people who have driven screening and programs. Now, screening is essential.
Yes.
It is 100% needed.
Yes.
When I first came back, sitting in Marcelle Ruth, I remember the first 6 months to 9 months being so discouraged that, oh my gosh, did I come back to just be telling people across the table that I'm really sorry, yes, you have cancer, but it's really advanced, it's spread to your liver, your lungs, your spleen, your liver, and there's nothing much that we can do. And one day I realized, okay, something, sitting here saying I'm the doctor who's come to treat, or with a group of other oncologists and so on, it's not the answer here. We have no national screening program. So we need to try and ensure that we start this, to support this screening. And there is no doubt from research, from clinical work, that early detection, you detect somebody in stage 1, stage 2, they can be cured from their cancer. Cured, 100%.
Yes.
Cancer is curable. Okay? But if it's picked up to advanced, then there's not much that we can do.
Yes.
And it's not all early cancers that can be cured, but at least there's a chance of it being cured. and there's a chance of the patient undergoing treatment whilst continuing their lives, their work. So yesterday on my ward round, there was a lady, she's a geologist, and she said, oh my gosh, doctor, I have a question to ask. She said, when I was told about this breast cancer, the person who told me as though I should go and pack my bags. This is going to be the end of the matter. I should go and do my will. He actually said that. He said, oh, I was so despondent. I said, I came here to Marcelle Ruth, and everyone is acting as if, yeah, a cancer, but this is the treatment. We're going on, we're moving. Go to work, come for your appointment. If you need us to change the time, it's okay. Do this. She was like, I'm confused. And so I said to her, and I had a conversation with her about how early detection saves lives.
Yes.
Early detection improves the outcome for treatment. And that's why we need to focus on screening.
Yes, very important.
Everywhere across the country.
Very important.
Now, I know the government is making, sort of trying very hard to put this in place. And in particular, in the last 3 years, there's been the development of NICRAT, the National Institute of Cancer Research and Treatment, who are already driving a number of huge policies, protocols, and engagement in setting up cancer registries, trying to develop screening in vital cancer elimination, and so on. And of course, Nigeria is big. We've got a population of 200 million all over the country. So yes, we're going to support them. But as the Women in Healthcare Network, one of the things we thought about was, yes, it's great that we're going to, through this network, support each other. And I would like to talk about that as well. The mentorship programs we're going to put in place, the leadership programs that we're going to collaborate with other people like WIHCN, and other places where this is being done globally, right? But as Women in Healthcare Network, we brought ourselves together. What can we do? What do we want to be known as? Where's our impact going to be for the other women in the country who haven't got the opportunity to have all this delivered to them, and even education and awareness.
Yes.
So why is our program or our thoughts or our vision different from what everybody else is doing? So picture when people do screening programs, churches will screen hundreds of people, right?
Yes.
On a Sunday or this month, especially in October. The number of people that screen goes up phenomenally in October. But what happens after that?
That's the problem. That's the main problem. Yep.
What happens when, because the results don't come back immediately. They have their mammo or their ultrasound and they all go home. I've had my screening.
Yeah.
What happens when there's abnormal results? Who takes that responsibility to contact the people, push the lady back, bring them back? And what happens even when you bring them back? Who is going to counsel them, and who is going to refer them to where the treatment can be delivered and delivered on time? So early detection is one thing. Prompt treatment
is important.
And is important.
Very important.
So what we are trying to design here is a 360 degrees, if you want to call it that, package for screening. And where we want to do it in a sustainable way. So what we're going to do is develop women's health clinics, but in already established primary healthcare centers. We're not going to go and build on new. We're not going to go and set up some shiny building. We're going to go into the communities, into the PHCs, and just use a room. But we're going to train the staff, and we're going to put in the equipment that's needed. And we're going to do it from even partnering with people who help us put the telemedicine down, so that every woman who comes, we get all their data, we know where they live, we know how to contact them, we know who their next of kin is, and so on. And then we have that data. We do the screening program with the equipment that we have, but also we can recall them if there's a problem, because we're going to train community leaders as well, who will be able to go into the communities and find them for us if there's an abnormal result, okay? And also we're going to partner on the other side with NICRAT, with teaching hospitals, with local other government hospitals, with the private sector who want to do CSR and look after patients. So that when and also, from a cervical cancer point of view, when we pick up an abnormal result, we're going to be able to do colposcopy in those centers, so that if it's a small lesion,
Yes.
we can remove it there and then.
Yes.
So there's no delay.
Yes.
Right?
Yes.
Okay. And then for the ones who need more treatment, we are going to be responsible for helping them in that journey of which hospital to go to, and to make sure that they are seen and that their treatment is done, and we're going to follow them up. Amazing. So that's the difference we're hoping to make here, in a very responsible and in a very sustainable way. And we're already so grateful, because we've already got the support of the female commissioners for health, of which there are 7 in the country, who are ostensibly part of Women in Healthcare Network, right? Who are ready, so that all the sort of red tape to get this done is not really going to be a problem, because we're within the same network. But also on the private sector, with the Private Sector Healthcare Alliance of Nigeria, and I'm very, very grateful to their CEO, who's already agreed, and to also the CEO of the MTN Foundation, because MTN Foundation have actually refurbished over 50 PHCs in the country.
Wow.
And yes, but both of them, they're all women, so you can imagine
yes.
how powerful. I know.
Yes.
And they're all excited, and they're all willing to help. And of course, we've got women in sort of on the sort of IT point of view, people like Fumi Adewara, Mobile Health, and so on, who are already providing that sort of data collection and telemedicine part of the story. And we're going to leverage on that in partnership with a number of them to make sure that we can use that. And so I think this is going to go even beyond the screening. And of course, we're going to immunize against HPV. But actually, I think we're going to hopefully improve the well-being of women, because there's going to be education about, the size of the birth control, and the size of your family, and good nutrition, and the importance of educating your children, and also building themselves financially as well, right?
Yes, so very important.
Exactly. So I'm so excited about this. I really think that that's awesome. A difference as we go along in the next 5 years, the way I see us helping the country, and then therefore hopefully working together with the government in their own programs to make sure that we provide screening for the widest population possible. And whilst we're doing that, we really bring women up, physically, and mentally, well-being, nutrition,
all around, holistically.
If you improve women, we're going to improve a village. Every woman you improve, you improve a village. And I know that this is, but actually
beyond the village, actually, yes.
Yes. And Chito, for me, my grandmother, when she came to Lagos to get married to her husband, who was the head of a primary school, he in the end had 3 children, and I don't know how many children, and 3 wives, sorry, and I don't know how many children. And he was only going to educate the boys after primary school. That was his goal, because he wasn't. But my grandmother decided that she was going to, educate her girls. She sold cloth material in Gota in Lagos, right? But because and I used to go in the summer holiday to go and help her. So this is what I saw. They had women. They used to call it a job in Yoruba. So they have a little tin box, whatever, like where you drop money, and then one person will have the money this month, and the next money, they will contribute basically. So that was, they couldn't go to the bank to get loans. This is how they raise money amongst themselves to drive their businesses. And later on, fantastic story, but my grandmother ended up selling lace and damask, which became very fabrics that were being used for weddings and ceremonies. So, and then she started, building houses, Space Me, I Space You rental business. But the point I'm trying to make here is that she had 6 children. One who became, one was a nurse, one was, professor of medicine, one was a librarian, her sons, one did engineering, I went to Stanford, and so on and so forth. I mean, when she came to Lagos, my grandmother was totally
the power of the woman.
So the power of support.
Supporting, supporting,
obviously,
yes.
It was by those women all coming together and loaning each other money to drive their businesses that helped her get the financial support to drive her business.
Yes.
And of course, each person then has to have their own personal resilience and vision and commitment and hard work. But, without the financial support and the support of other people around you, it's much more difficult. So going back to the screening programs, that's what I'm hoping. And I'm hoping that we will kick off in the second half of this year. We're spending the first half of this year. We're just we're submitting proposals for grants to support this. But we're also organizing the collaborations that are needed across both government, public sector, and private sector to make sure that the steps are in place so that once we start, we're sort of running with it. And that's what we're looking for.
So you've given me another reason to be really excited about being a member of WIHCN, because I mean, this is really up my alley and one of the things I'm extremely passionate about. Women's healthcare all over the world globally is always put behind, and we haven't been able to bring women's healthcare to where we need to bring it because it's important. And I love the example you gave, because this is why we say women being healthy is so important to not only the individual woman, but to the community, to the country. I always say that, women are the neck of a nation. And if you know the function of a neck, you know how important it is to have a neck. And I think what you're doing and having this 360-degree approach to being able to counter and to screen, not only screen, but to manage, because that's the hard part. I mean, being told you have a problem and not being told how you can fix the problem is the worst possible thing you can do to a human mind. And I really think that will make WIHCN so much stronger. And now I'm so proud. This is amazing. I think just hearing this initiative has got me really, really excited. It's amazing.
Oh, I'm so glad. Because, and even, we're not saying we're going to have the money to treat them, but we can, there's a cancer health fund. How do you tell a lady who lives in, I don't know, whatever, Badagry local government, that she has cancer and she should go and navigate this? She can't navigate it herself. There's no way, right?
Yes.
So if we then have our people in the primary healthcare centers and the community workers, and we are there as well, we'll have a process in place. We can help them say, okay, you go to Ekpe General Hospital, which is now going to become a federal medical center, by the way. I just thought about that. And so on, and we can help them, ensure that they go. Because otherwise, what happens is you make the diagnosis for these women in the more remote, poorly resourced areas, and then they give up, as you say. And so it's helping them navigate. And there is a cancer health fund, so we just have to make sure that we know what the process is, so that we can help them ensure that they can get into the process too. And also, there's some incredible NGOs. Honestly, Chito, I've been amazed by the number of people and the number of organizations that are here in Nigeria trying to do the right thing. So I belong to a group called the Nigerian Cancer Society, and on there are a huge number of NGOs doing work for different aspects of cancer care, for example, who are ready to help. So we just need to be able to make this connect. I don't know if you saw a video recently that I saw of Ibuka Awushika. I think I was talking about it last night, who I think was at Kellogg Business School, where they spent 4 days, all these incredible, amazing leaders from different parts of the world learning. And on the fourth day, the moderator said, so do you all know what each other are doing and what problems you might be having and where you need help from? And he made them talk to each other and stand up and say, okay, this is who I am, this is what I'm trying to do, I'm stuck here, I'm stuck there. And apparently at the end of it, I mean, this is just what I do from the video. I haven't spoken to her yet, but I do need to try and find her to speak to her about this, because I was amazed. But every single person who had gone to that 4-day or whatever number of days retreat it was to learn, found somebody in that same group who had the solution to their problem.
That's powerful. Yes, that's amazing, because that's important. Network.
Exactly. So for Women in Healthcare Network, we're going to hopefully do this to provide help for women in resource space, but also where charity begins at home.
Yes,
and
yes.
I'm also very passionate about that. And we have to be our own resource, our own support. The way I see this is, for example, a young pharmacist in Ibejuleki local government, being able in the same event to meet Joke Bakare, who set up Med Plus, that has now got 100 and something shops across the country, and for her to be able to talk to her and ask her how that journey was,
Yes.
and to take tips from her from time to time.
Yes.
And definitely, even if she doesn't end up with 100 shops in years to come, she will definitely have progressed from seeing the opportunity to lift herself up from whatever she is in her career to where she could be.
Yes.
You know, and that's really, for me, I think this network is going to be this powerful. So at this point, I also want to say a huge thank you, in particular, to the Coordinating Minister of Health, Professor Ali Pate, because I think that by singularly coming to our launch, and I've never met him before in my life, to be honest, but somehow, you know, when you're doing these things, you write to everybody.
Yes.
And when I heard that he was coming, I actually thought, okay, he'll send a representative or not. But he actually came himself, and I do believe that it's one of the reasons, apart from who the people are, the founding members, that this actually helped us get that credibility from people that actually this is I'm going to be a network that's going to really do what they said they're going to do, but also be recognized from the public sector, which makes a difference.
It does make a difference
in terms of doing what we want to do. Yes.
He knew. He said he better be part of this Women in Healthcare Network.
Yes.
He was smart.
Yes.
He knew that.
Yes,
because
exactly.
of time, there's two questions that I want to make sure we answer. First of all, we can't forget that the Marcelle Ruth Cancer Centre and Specialist Hospital is organizing a walk against cancer on February 7, 2025. And this is an incredible initiative to raise awareness. Tell us about the event, what you expect to achieve, what's your objective, and how the community can get involved to support this vital cause. Because we talk about supporting women supporting women. It's important. I always tell people that it's not only, your awareness is important, but there's always support needed to be able to spread the awareness. And coming from what you said about the 360 degrees on that screening, it's something I believe people should really jump in to support as well. So tell us more about this event and what we are suspects.
Yes. So our walk started from the basis of what I just said earlier on about coming back and seeing most of the cases were advanced cases and so on. So we decided as a strategy in Marcelle Ruth to A, set up a foundation, and B, to do a lot in education and awareness. It wasn't all right to just sit where we were and expect patients just to come to us and then be treated if they could or they couldn't. So first of all, we put a annual screening plan in process. It's called the concierge service, and it's open to everybody and so on. And then we started doing the walk. So we walk from the front of Lagos State House and Marina to Marcelle Ruth. Is a 5-kilometer walk. We've done it every year during the World Cancer Day week. Mm-hmm. And of course, the theme for World Cancer Day for 4 years has been closing the care gap. Education and awareness being pivotal to ensuring that people are aware, and therefore they go and check themselves, even if it's just from the daily breast examination to going to have your blood tests, to having your PSA done as a man and so on, and being followed up. And so we started the walks, and it's been incredible. This will be our 4th year. And last year we had about 500 people doing this walk. And I will tell you that from a clinical point of view, we have seen a difference in the fact that we see many more patients now presenting early. And we're just one organization. Yes, and I think because obviously the cancer walk is done across the country during that week. So for us, it's become a must do. And we have a support group at Marcelle Ruth called Marcelle Ruth Friends, which is open to any patient who's been treated and their relatives. And they're about 300-400 strong. So they had a sleep and pain party just before Christmas because one of the patients developed doing art during his cancer journey, which he felt has really helped him. So he was sharing that, and so they had this super empathy. But going back to the walk, we start at 7 o'clock in the morning, and we're very prompt, to be honest, so that people do get to work afterwards if they need to. Lagos State House to Marcelle Ruth, and when we get there, we offer screening, free screening to some people. Also this year, we're going to have a short fireside chat with Farouk Oriagba, known as Mr. Steez, and who is a cancer survivor, as well as a number of other, I think there are 3 or 4 of them, who have very generously agreed to share their stories. Actually, also with the gentleman who's been doing the painting, he's going to come and show people what the artwork that he's done and so on. And then also we will be there from the healthcare point of view, answering people's questions, and yes, to encourage anyone and everyone who lives in Lagos, who has time, to please join us. But join us with your teams. So we want a team, Women in Healthcare Network, by the way, all right? Yes. Okay, and team, but it's going to be Team Marcelle Ruth Friends. The number of companies who have supported us year in, year out. You know, First Bank, MTN, and so on. There's quite a lot. I can't, Providence, Zenith, not just the banks, but different firms. And it's not just about supporting us from a financial point of view, which is important, but it's actually in coming out to work with us. And when we walk along the way, you can see people being interested. What's going on here? What's happening here? And of course, we have press on the day who come. So it's important. It's very important. I see it from the other side, from the clinical side, and I'm so grateful. We've treated over 1,000 breast cancer patients at Marcelle Ruth, and now the majority of them, honestly, are early cases.
Wow.
And most of them are, getting their care on an outpatient basis, coming for their chemotherapy, going back to work, or whatever else they're doing for 3 weeks, and then coming in for the next 3 weeks. And it's a 3-weekly cycle, and then surgery. The journey is long, that's for sure, but at least they can do it at home. You know, I mean, one of the things I was, is we have women now who are supported by their girlfriends, their relatives, who will come and sit with them. Whereas every time they think, if they had to go to India, if I had to go abroad, it would have just been me or my husband or me and one sister or somebody, and the burden psychologically, and also financially, because if you have this and then you have to stop work to go abroad, you can't do their work. Oh, I'm going to make you laugh. There was someone who told me last week, and these are all true stories. She's an event planner, and she was, at the beginning, she found it really tough and everything. And one of the things, she was like, just getting to the pinnacle of her career, when people are always calling her. And I said, well, you can do it. You can do it from here. You can have Zoom. If COVID didn't teach us anything, you can have your meetings by Zoom,
virtually,
right?
Yes.
Exactly, and then you can organize your team and so on, and then you can, deliver. By the time they try, during the event, we can try and tweak your treatment if we can. And she stopped me and she said, Dr. Elebute-Odunsi, I tell you, I owe you. I said, what? She said, do you know I've doubled my revenue in these 9 months that I've been undergoing cancer treatment. I said, that's not just because I've managed to pitch for more businesses because I wasn't all over the place, but because I wasn't going to meetings. Because, she was taking events in Port Harcourt, in Abuja, but she used to travel. She'll travel to pitch to them. Wow. She'll travel back with 3 members of her staff. So you're paying your flights, you're staying in hotels and so on. But because she was doing it from her house or her room,
she saved her money.
Her costs went down. I know. So, but also she feels so much better because she's been through this cancer journey. In fact, it's her last treatment is on Friday.
Yes. I must say that I will just tell you through this conversation is the first time I've had cancer so many times and my pulse is still normal.
Yes. Well, that's a good one.
Normally I don't hear it normally, and my pulse.
Which is what the geologist was saying, that I came here thinking, oh my gosh, there's that test, but those cover my head, and now, it's been amazing. It's been such a blessing.
I wish we could have this conversation unending, but because of time, But I have to,
Yes.
because this is we what the HERcast with Dr. Chito's theme this year is the year of the climb. So we're talking about how we can just come, and rise from our pain and our challenges and just climb, and that
Yes.
take away the baggage and all that. So I want to end with this question:
Yes.
what message will you give to especially young women looking to make a difference in the healthcare industry? What message, and I'm sure this will translate to other sectors. What's that message you're going to give to these young women or wanting to rise? And young women doesn't mean only by age; it's also youth by heart. Because I call myself
Yes.
young by heart. I'm like, I'm
Yes.
youth by heart. Hello. So,
Yes.
what message do you
Yes.
give to women in that
And
looking
yes.
to make this impact?
It's a fantastic question. I'd like to, for women, yes, but for generally, and this is looking back, not just even in coming back, because the coming back, oh my gosh, it's been so tough. It really has.
Yes.
Nothing has been easy here, right? But I believe strongly, and I think this even comes from parenting.
Yes.
I had parents who made us believe that we could be whoever we wanted to be.
Yes.
And we could do whatever we wanted to do. That was such a powerful message from my parents. So I think even as women, it's a message that we need to be able to give to our children, But as people, as a person, you want to do something, sit down with your journal, write down what it is. That's what I did. In 2012 was when I had this thing about coming back to Nigeria. I still have my journals. Sit down, think about what you want to do, prepare yourself by educating yourself or getting any qualifications you need to get to. Just keep going. Yes, there will always be difficulties. There will always be challenges. We spent 1 hour talking about the great things about Marcelle Ruth and the women in healthcare. I could spend 1 month telling you all the difficulties and the people who try to make sure. My husband said, when we were wanting to do Marcelle Ruth, if we told 100 people, 99 people said, are you serious? You are living in England, you spent all your career, you've done great things, you want to come back to Nigeria, you want to invest your money in Nigeria, what are you doing? Never listen to the naysayers. Never.
Very important.
Nobody is responsible for your vision.
Oh, that's
of
important.
who you want to be,
Very
apart
important.
from God who made you.
Yes.
Nobody.
Yes.
No one can take your vision away from you. No one can stop you being who you want to be, apart from you and your maker.
Yes.
And you, when I say you, because you will have to do the work. You will have to sweat the sweat. You will have to make the sacrifices. You might have to relocate. You might, whatever. You don't have to say, but you have it in you. Everybody has it in them to be who they want to be. Yes, there will be difficulties. Yes. In fact, if challenges actually, I think, are what sometimes help you get better. When you go through a challenge, right? And you survive it and you see yourself forward because you grow. And then you look back. Always look back. I always look back. Oh my gosh, 4 years ago, Chito, the week we opened Marcelle Ruth, I remember standing there crying. I called my husband and I said, 3 or 4 patients have come and said, the cancer in this name of this place is going to be a problem. Or, there's a stigma in cancer in this country.
Yes.
And my husband said, we built the hospital, we brought a radiotherapy machine into the country, and you don't want to call it cancer. Don't worry about it, we'll be fine.
Yes.
We've now seen almost 5,000 patients.
Yes. Ooh, yes. This is a very powerful conversation. I'm just saying that yes, it's going to be a 1 hour conversation, but we need to break this down and share this because it's so powerful. The conversation we've had is amazing.
I love your theme. The year of climb. I love it. Year of the climb. I don't know where you got that from, but that's powerful. That's powerful.
Thank you.
Climb.
Yes, we got to climb. Yes.
Also need to take people up
with us. That was the theme. Take people up with us. Climb climb together.
We take others up with us.
Very important.
God rewards those who support each other. Yeah, that's for sure.
Well, now we've come to the end of this conversation. But remember, we said this is not your last time. All right? This is definitely not your last time.
Yeah, this was too enjoyable to be the last
time.
Yes.
Yes.
This is very fun. I think the sip and paint party last night with the wine helped actually.
Yes.
Because that was such fun.
Yes, it was. What an incredible episode this has been. We've had the privilege of speaking with the phenomenal Dr. Modupe Elebute-Odunsi, an exceptional leader, change maker, and a true inspiration. And from her journey of excellence in global healthcare to establishing the Marcelle Ruth Cancer Centre and Specialist Hospital and founding the Women in Healthcare Network, Dr. Odunsi has shown us what it means to lead with purpose, vision, and a passion for uplifting others. Her story reminds us that no dream is too big, no challenge too great when we dare to rise above limitations. So as we wrap up, let me leave you with this. This is your year to climb, to break barriers, and to shatter the limits we often set on ourselves. At HERcast, we're here to empower you to overcome challenges, to gain knowledge, and thrive. With every episode, we aim to inspire your boldness and transformation, helping you to embrace your authentic self and reach your full potential. Remember our tagline, her strength, your inspiration. Keep being audaciously you, unapologetically, fearlessly, and beautifully. Listen to us now on Spotify, Apple Podcasts, Google Podcasts, and all your other favorite podcast platforms. Watch us on YouTube, HERcast with Dr. Chito. Follow us on our social media platform at HERcast Podcast and at Dr. Chito N. And most importantly, catch us on Rapid TV channel 176 Star Times, Saturday at 7 p.m. and Sunday at 2 p.m. Until next time, I'm Dr. Chito, reminding you to live boldly, lead with your heart, and keep pushing for the change you want to see. See you on the next HERcast. God bless.